Hello everyone, welcome back to the course on humanities, Indian and Western medical knowledge traditions. This is lecture number 55, Indian and Western perspective on mental health. In this lecture, I'll talk about how the mental health of people in India or children in India are determined and how mental health challenges are increasing globally but manifest differently in India and the West. When we look at the conditions of mental health in India and the West, they have their different manifestations, different regions, different causes of manifestations, both in the Indian and Western context. They face certain common issues, for example, like stress, anxiety, and depression. But the causes and social context of mental health in the India and West differ. We find that how Indian and Western have different social and cultural practices that lead to different kind of mental health concerns, and these practices sometimes help to heal one's mental anxiety, one's depression, but sometimes they also promote. So when we look at the causes, we find that the mental health in Indian and Western contexts are influenced by cultural, technological, educational, family-related concerns and pressures, and they shape the challenge. They provide new dimension to understand the mental health, particularly the mental health of young people, or young children, or adolescents. So when we think about or when we discuss about the mental health in Indian context, we need to focus on that how in India we have now a rise of mental health cases because of rapid industrialization. Because of the industrialization, we find that now the family is breaking down, or the parents stay away, and then they are busy in their own jobs. They have very less time for their children. Also, with the over workload, the adult people also face mental health concerns. So the rise of rapid industrialization has led mental crisis for both the young children as well as the uh, elder peoples as well, because they do not have much time for themselves and their family members, their children. Then the role of digital exposures has led to further psychological conflicts, particularly in the young people, in the young children. The social media, maybe Instagrams, Facebook, or maybe different kinds of like online games, for example, like a Blue Whale Challenge. They are linked with stress, addiction, and depression. These social media actually produce certain kind of norms, and those children who are not able to fit themselves in those norms, then they become victim of mental stress. For example, when they look at the other people, how they live in, how they have different places to go for traveling, and the kind of lifestyle or luxury one is affording. And if those who are not having this kind of access, and then social media can influence the mind, the mental health of the young children. Further, different types of games and addictions and different kind of videos cause depression, anxiety in the young people. We also have now in the Indian context the breakdown of families, the rise of divorce cases between parents, the development of a single unit family. Earlier, India was having a joint family systems, and where in the absence of parents, if they are busy in their jobs, then the elder parents or other family members were taking care of children, but now they are left alone, and this is like lack of social minglings, or lack of having any kind of communication with other people have led to isolation and exclusion, and that further increases their stress and depression. In the Western context, we find that the examples of excessive screen time and social media, for example, Instagram, TikTok, and many other kind of apps that affect the mental health of children. Moreover, in their context, they have most of the children have to spend most of the children have to spend their life and their time with a single parent because of the very excessive rise of divorce cases. So this has led to the lack of family systems, the lack of proper communication in the family has been also seen as a severe cause of mental distress in the Western society. However, when we look at the time spent on social media or on mobile phones, we find that as per reports that in Indian youth, Indian children are spending most of the time on mobile screen or on social media. And this can lead to both the concerns of cyberbullying for Indian as well as Western children, Western people, and that can cause depression and anxiety. We also find the examples of digital overstimulation often results in anxiety and reduced attention spans. This can lead to a new kind of mental disorder. When we look at the family structure and social structure, that can also be seen as a cause of health concerns. For example, in India, we find that that joint families are getting reduced to nuclear families, and children lack emotional support. There is a lack of open communication to foster emotional repression and isolation. So the lack of open communication fosters emotional depression, because in the societies which are closed, where people cannot communicate their thoughts, desires, and feelings to the family members, the possibility of higher mental health concerns can be there. In the Western context, we have larger family breakdowns, cases like divorce, single parenting that affect the mental health of children. It is a kind of individualistic culture, and that can limit communal and group coping, and people are often lonely. And the reason for pressure for both Indian and Western contexts are the educational systems, the very high and competitive systems where they have to cope with the academic needs, they have to cope with the systems of education where they cannot be lagged behind by other people, other students. Moreover, they also have higher parental expectations, exam stress, and fear of failure. They are overloaded with curricula, and they have pressures from that colleges to perform better so that they can show the result. This is like worsening the mental health of young kids, young children. Similarly, in the Western context, they too have problems in terms of standardized testings, because different children need different kinds of testing methods. They too have college admission pressures, bullying, school shootings, and many more things. And further, in the Western context, they have identity struggles during adolescence, and particularly in terms of sexual orientation, gender identity, and their personal relationships that can increase the health concerns in young children in both Indian and Western context. We find that both Indian and Western societies have different approach to heal these mental crises, mental depression. In the Indian context, they provide a holistic framework and where the focus is on the integration of mind, body, and spirit, where they can live in harmony. There are also the like balance of dosas, vata, pitta, kapha, and meditation is one of the best possible way to heal the mental health, and it can help the people in different ways through breath control, which is called pranayam, and this is very useful for mental well-being. Spiritual traditions also offer healing for mental stress, and it suggests that one should be having righteous actions and one should have follow righteous and contextualized actions that can help them in their spiritual growth. Moreover, community and family oriented bonds also provide sufficient support to the children, to the young and adult people, and this can help them to heal their mental health. However, in the Indian context, the one who is having mental illness, they face stigma and they are silenced. So this cultural reluctancy to openly discuss mental health and illness are very significant concern in the Indian society, and this needs to be addressed. In the Western context, there is like biomedical approach where mental illness is treated as medical conditions, and the focus is on diagnosis and symptoms management. They also have the use of psychotherapy and psychiatry, and that can help in terms of like healing mental illness through different means. But at the same time, they have, compared to India, less stigmatization, and they consider now mental health as one of the normal concerns. Thank you.